Okay. All right. Well, hello and welcome. My name is Rafael Castaneda. I am Vice President of Workforce Development with MedCerts, here with Kyle Bachman, a recruiter with Goshen Health. And we wanted to go through from his perspective and talk a little bit more about how he is approaching talent acquisition, procurement, and some of his perspectives on how this has helped his employer in the industry. So, Kyle, thank you so much for being willing to do this with us. I know your time is limited and valuable, so I just wanted to say thank you. But if you could please start by just introducing yourself and tell us a little bit more about your organization, that would be great.
Sure, and thank you for having us, and thank you for having us as a partner. It's been a great relationship so far. So, again, Kyle Bachman, I'm a recruiter with Goshen Health. There are three of us here with our recruitment team. We are a fairly small health system in northern Indiana, made up of a hospital, three-time magnet, recognized health system with 110 beds, I think, currently. And then our 35 outpatient locations made up of our physician network, ambulatory surgery center, home medical equipment, and home care and hospice. I've been with the health system for about 7 years in total, most of which has been recruiting. So it's changed quite a bit during that time. Have had to become much more proactive, I think, in our approach in recent years.
Okay, great. Well, thank you for that. I mean, I'd like to dive into a little bit more about your perspective on the landscape for healthcare recruiting and, the challenges that you've experienced and, your perspectives on, do you see this changing anytime soon, or is this kind of something that you're seeing as like the norm going forward? So, what has the landscape been like for you? What are some of those things that you've run into, and what are some of the solutions that you've come up with?
Sure. So boy, the last 2 years have been a challenge. We've changed pretty much everything that we do from a recruitment standpoint, and that we're doing a ton of sourcing. We're seeking out candidates rather than waiting for them to come to us. It's exciting for us as a recruiting standpoint currently, just because we're getting to be innovative. We're moving to telehealth as a clinical approach, but also as a recruiting approach, where we're doing everything via Zoom, remotely, and trying to meet trying to meet candidates where they need to be met. They might be working from home, so we might need to meet them in that setting, that type of thing, and going to more of a work from home type environment with our clerical type positions, that type of thing. I don't see it letting up as far as the challenge with recruiting is concerned. We've seen the baby boomers leave the work environment, whether that be retirement or early retirement. Some places just can't accommodate. Obviously, if you're a clinical colleague and you're seeing patients, we can't have you do that from home. So it has presented a challenge, but it's an exciting one and one that's driving innovation, I think.
Great. I like the innovative approaches, as you've said. The necessity being the mother of all invention, I think, is definitely relevant here, where in 2019, we never would have considered certain things, but as we've gone through the last couple of years, as you stated just perfectly now, is that you have to look at it from a slightly different perspective. And you mentioned like working from home from a clerical perspective or position. How are you approaching like more of the clinical roles that you're recruiting for? Obviously, those, like you said, can't be done from a home environment for the most part. How are you looking, and is that different than, say, maybe more of those clerical roles in terms of recruitment?
Sure. I mean, we've had to get creative, and that's one of the big things that drove our partnership with MedCerts. We've done a really good job, I think, at least since I've been here, and not because of me, but because of our team, of working with area schools. So we have Goshen College right across the street. They're a huge source of nurses for us, but we work really, really heavily with two-year programs in the area, whether that be the Ivy Techs, the Southwestern Michigan colleges, Ross Medical, so on and so forth. But what we've found is that the supply is just not keeping up with the demand. I mean, it's not only Goshen Health that's striving to find candidates. So we are an organization that really works to promote internally. That may mean moving you to top a license, but it also may mean creating that license. So creating those educational opportunities for our entry-level employees, our colleagues, but also doing that for external candidates. You may be someone that didn't have the opportunity to go to college right out of high school. Never had the money to pay for that type of thing. So being able to provide that opportunity to our community that wants to get into the healthcare field is huge for us, especially for even new grads from high school. When you think of healthcare, most people think of a doctor, a nurse, maybe even a nurse practitioner, because you're seeing more and more of that in primary care. People don't think of allied health, so your imaging positions, your medical support positions, your phlebotomists, so on and so forth. So being able to provide an opportunity for people to get into the healthcare field from the ground up has been huge for us.
That makes a lot of sense. You know, that sounds like those formal partnerships to help fill your pipeline, you know, from a training provider, whether it be a two-year school, an online provider like MedCerts. It feels like you need a variety of different partners to be able to fill that pipeline, which we expect, and I mean, please confirm this for me, but we expect, as you had mentioned, that pipeline to continue to be needed in an evergreen state. Like, probably not looking at this going away anytime soon, since, as you mentioned, the birth rate is not replacing the death rate, and the population of our country is actually getting older. So we're going to need more of these healthcare professionals as time goes by. You know, if you were to give advice to, you know, another healthcare employer, you know, about something like this, what would be a couple of pointers you would give to them from your perspective and experience?
Yeah, so I think you hit on the biggest thing, and one, this lack of a workforce is not going away. There's always going to be a need for clinical support staff. So developing that ongoing pipeline of candidates to supplement what you're getting from an applicant standpoint is huge for us. I think it's huge for every healthcare organization. One, because we're kind of cannibalizing our own. We're stealing from Peter to feed Paul, or that's not even the right expression, but you know what I'm trying to say there. I'm taking from our competitors, and they're taking from us, and we're kind of in a bidding war right now. So develop your candidate pool. It's been huge for us. We're not able to sustain 30, 40 students at once, but constantly having 6 to 7 in the pipeline that are going through and staggering through courses has been huge. We're just nearing basically our first cohort of graduates, so they're going through those clinical rotations right now. About to fill, I think, 8 to 9 of our current openings, which is about a third of our current clinical medical assistant openings. Supplement that with our work with area colleges and everything, and that's pretty much the only way that we're staying afloat as far as that clinical support role is considered. So invest in your colleagues would be my biggest word of advice. Invest in your colleague base, grow those people, those entry-level employees that are interested in going on to a clinical type role. But it's also been a huge tool for us from a recruiting standpoint. I mean, it's been amazing to me when we turned on the social media advertising, how many hand raisers we got. And some of those are going to be placed in other roles within the health system. Medical assisting may not be that end-all solution for them, but just opening those doors, I think, has been crucial. To other health systems in our area, don't steal our candidates, I think would be helpful for me. But yeah, MedCerts has been great. And we're looking to expand our partnership as well into other areas other than just medical assisting.
Excellent. Well, Kyle, thank you so much for your time. Obviously, appreciate the insights coming directly from the source, if you will. And really just want to say thanks for the time again.
Of course. Thank you.